get started. Okay, so chapter 20, it's about the lymphatic system. So the lymphatic system has primary and secondary organs that as a whole, they help to filter the lymph, which is the fluid from the lymphatic system. And the lymph, it's a fluid that comes from the excess of fluid from the interstitial space, the space in between the cells, that it is not picked up by the capillaries. If you remember, the capillaries filtrate fluid rich in nutrients and gases like oxygen into the cells. So the cells, once they pick up this fluid and then they utilize these nutrients and oxygen, then they can release CO2 and wastes. So now the lymphatic fluid, which is found in the interstitial space, the space between the cells, it will not be picked up by the lymphatics, by the capillaries. So then that excess of fluid that is not picked up by the capillaries, it will be picked up by the lymphatics. Okay, and then there is the potential that that fluid has bacteria, has microorganisms, or have cancer cells and antigens. So then this fluid, as it goes in the lymphatic system, it will be cleared up, hopefully, by any harmful things that we might have within this fluid. Now, the lymphatic vessels that pick up this fluid, the lymphatic fluid, will be blind-ended, not like the capillaries or the veins that are always continuous. In this case, they have a blind end, and that also helps them to collect specific amounts without being distributed anywhere, and they follow only one pathway. And this pathway, it won't be related then to the presence of pressure to be flowing into certain direction. It was just that you have more fluid in one end than in the other, and then that fluid helps to push the other fluid into other areas, and then you will have compression of these vessels that helps to move that fluid. Now, we also have lymphatic tissue. So we have two different types of major structures within this lymphatic system. So we have three things. So we have organs, tissues, and then lymph. So the organs can be subdivided into primary, which will be bone, marrow, and then the thymus. And then secondary will be lymph nodes, spleen, and then appendix. And then for tissues will be non-encapsulated, and will be mucosa associated lymph tissue and then that's one of the tissues. And then we have tonsils. And then the lymph has cells. So we have T lymphocytes. So will be fluid with T lymphocytes and fluid with B lymphocytes. It's the same, but the cells are different. And then what other cells we have? So instead of repeating that, let me just write down the cell's name. So, well, let's put just lymph. This is the fluid. And then cells. So we have T lymphocytes. We have B lymphocytes. We have natural killer cells. And we have macrophages. We have memory T cells. We have helper T cells, which are also known as CD4+. We have cytotoxic T cells. Which are known as CD8+. And then we have regulatory. / suppressor T cells. B lymphocytes will be naive, will be plasma cells. And then will be memory B cells. Macrophages, they don't have, they have a specific names based on where they are. So we'll see that. And then natural killer, just natural killer. So lymphatic system structures. We have organs, primary, secondary. We have tissues. Tissues are different than organs. Organs have a capsule. So because they have a capsule, they have a defined shape. These ones, the tissues, if they don't have a capsule, they are diffuse. They don't have a shape. And then primary organs is either where the cells are produced or where they are mature. Both B and T cells, B and T lymphocytes are produced in the bone marrow, and B cells mature in the bone marrow while T cells mature in the thymus. We will see later what is the thymus. And then the secondary will be lymph nodes, spleen, appendix. And then tissues will be tissues that are associated with mucosa that we call MALT, M-A-L-T. mucosa-associated lymphoid tissues, and tonsils. And then we have fluid, which is lymph, and then we have cells. T lymphocytes, B lymphocytes, NK cells, natural killer cells, and macrophages. And then we have subdivisions of T: memory, helper, cytotoxic, suppressor. And then we have 4B, naive, plasma, and memory. So in the lymphatic tissue, we have clusters of lymphocytes. And these clusters are called lymphoid follicles. That includes the tonsils. The tonsils, we have them in the upper respiratory tract, at the entrance, and also at the entrance of our mouth. So we will see more details about these tonsils, but here is an overview of all the structures of this lymphatic tissue. So here are the tonsils. All of these lines represents the lymphatic vessels, and these little green dots here represents the lymph nodes. So lymph flows through these to these lymph vessels, and then it will get trapped temporarily within these lymph nodes to give time for the lymphocytes to find if there's anything wrong with the lymph. And then for the tonsils, so we have tonsils behind the entrance of our nose. So these are what we commonly known as adenoids, but these are the pharyngeal tonsils. And then on the sides of the oral cavity, we have the palatine tonsils. These are the ones that frequently get infected with strep bacteria, and that hurts when we eat something. So then at the base of our tongue, we have the lingual tonsils, and then around the entrance of the pharyngotympanic tube into the throat. So we have also tonsils there. Now, the lymph nodes, they form chains, and then we call them according to where they are. So if they are in the cervical area, we call them cervical lymph nodes. And we have superficial and we have deep. If it's here below the shin area, we call them mental lymph nodes. And then underneath here of the mandibular angle, we call it submandibular. The ones that are here by the parotid gland, we call them parotid lymph nodes. The ones here on occipital area, we call it occipital lymph nodes. The ones here in this area, axillary area, we call them axillary lymph nodes. And then we have that tracheobronchial that are located here in the respiratory area in the thorax. And then we have cubital lymph nodes here. We have the gastric lymph nodes in here, celiac somewhere in here, hepatic next to the liver. And then we have here embedded within a membrane that holds the intestines into the back wall of the abdominal cavity, mesenteric lymph nodes. This will be the inguinal lymph nodes. We have also lymph nodes in the lumbar area. So they take different names. And now, here we have these trunks that drains the vessels. So the vessels, they merge and they form trunks. So this is the right lumbar trunk, this is the left lumbar trunk that anastomose and forms this dilation that receives not only the lymph from the lower part of our body, but also from this abdominal cavity. So this will be the cisterna chyli or chili. And then this cisterna chyli as it goes up, extends this duct that is called the thoracic duct that drains here into the left subclavian vein, returning the lymph back into the circulation so that you don't have waste of this interstitial fluid. Now, this duct, it is the largest in our body, and it drains everything from below the diaphragm and everything from above the body on the left side, including the upper limb, the thorax, the left hemithorax, and the left side of her head. So that's the thoracic duct. Now here we have the right lymphatic duct that is smaller than the thoracic duct and receives the lymph from everything above the diaphragm on the right side, including the upper limb, the upper side of our right side, of the head and the neck. And this right lymphatic duct, it is formed by the merging of this right jugular trunk and the subclavian trunk. While this one, the thoracic duct, it is part of the merging of the left jugular trunk and the left subclavian. So we will see more details, but that's the overview. The spleen, it is part of the lymphatic system. It gets rid of erythrocytes and also houses lymphocytes and macrophages. And then here we have the thymus. In a young person that is less than 14 years old, you still will have the thymus. The thymus is training the T lymphocytes, but once we're born, we don't need a thymus. Once we age, we don't need a thymus, so that ingresses and becomes very small. It's just a part of fat that it is on the mediastinum, on top of the heart. Okay? So functions of the lymphatic system will be regulating the interstitial fluid volume. If the capillaries will only leave the fluid there and it will not absorb part of the fluid, well, we will have accumulation of fluid, and that will lead to compression of the tissues. That actually happens sometimes when there is obstruction of the lymphatic vessels, like by parasites, or maybe when they remove lymphatic nodes. For instance, if someone has surgery of breast cancer, they can remove part of these lymph nodes, and that can damage part of the vessels that drains the lymph, and then the person oftentimes end up with edema, accumulation of fluid in one of the limbs, like it can be the right or it can be the left, depending on where the surgery takes place. Why? Because you have accumulation of fluid. Okay? And then we have specialized lymph vessels in the gastrointestinal system, in the enterocytes, that are called lacteals. These lacteals absorbs lymph that is rich in lipids. So it's capable of absorbing dietary fats. And then in general, the lymphoid organs help to filter pathogens and also filters cancer cells, hopefully. It's not foolproof, otherwise we won't have cancer or metastases. But what you're hoping is that as you are holding with these lymph nodes, as you are holding lymphocytes, these lymphocytes are capable of recognizing the cancer cells when it's possible. Not all the cancer cells can be recognized because not all have antigens that are able to be recognized as cancer cells. So here is how the lymph circulation takes place. So you have the lymph collecting vessels that are called lymphatics, plainly and simple. And then these lymphatic vessels collect lymph and merge to form 9 larger lymph trunks in our body. So here are some of the names of these trunks. So we have the lumbar trunks that receives the lymph from the lower limbs and the pelvic area. And then we have the intestinal trunk that is the one that basically absorbs the lymph from the lacteals and then delivers it into the liver so that we can process these dietary fats. And then we have the jugular trunks that are here on the sides of the neck, on the trachea. And then we have the bronchomediastinal trunks that drains the lymph from the thoracic cavity. They're located deep in the thoracic cavity. It's near to the bronchus. These are the airways. And then we have the subclavian trunks that are located underneath the clavicle, and that this receives the lymph from the upper limbs. So, in the abdominal cavity, deep in the abdominal cavity, we have the cisterna chyli or chyli. So this one receives the lymph from the intestinal and lumbar trunks, and that's why it's dilated. Cisterna means like water well. Water wells are deep and they hold water. So in this case, this cisterna chyli receives fluid, which is the lymph. And now as it's moving up, it loses this dilation, so it will become just a tube. So this is going to be the thoracic duct. And again, the thoracic duct, it is large. It runs from the cisterna chyli up to the left subclavian vein. So the lymph drains into veins so that you can keep circulating this fluid between the lymphatic system and the circulatory system. Now, this thoracic duct receives not only the lymph coming from the cisterna chyli, but also from the from the left internal jugular trunk and the left subclavian trunks. And now, the right lymphatic duct will receive the lymph from the upper right side of the body, including the lymph coming from the right jugular trunk and the right subclavian trunk, draining into the subclavian vein, the right subclavian. So here it is, a view of all these trunks and how they drain into specific areas and how they form the ducts. So vessels, when they merge, they form trunks, and trunks where they merge, they form the ducts. So here we have left lumbar trunk. This is the intestinal trunk, and then the right lumbar trunk. All of them drains into this cisterna chyli, and then the cisterna chyli continues up, running into this thoracic cavity as now what we call the thoracic duct. No matter if it's in the abdominal area, you still call it the thoracic duct. And then this thoracic duct drains here into this left subclavian and receives the lymph from the head, the left side of the head, by the left jugular trunk. I call it internal before, but no, it's just called left jugular trunk. And then it receives the lymph from the arm from this left subclavian trunk. And then in the left side, in the left thoracic area, this trunk receives, this duct receives the lymph from the thoracic area on the left side through this left bronchomediastinal trunk. So the left bronchomediastinal drains into here, and then you have on the right side then this right lymphatic duct that receives the lymph from the right side of the head and then the right side of the neck by this right jugular trunk, and then the right arm drains the lymph into this right subclavian trunk, and they merge and they form this right lymphatic duct, which also receives the lymph from the right hemithorax by this right bronchomediastinal trunk, which is this. Any questions? It's easy to see in this diagram what drains what. Thoracic duct, basically almost 3/4 of our body, while this one, this right lymphatic duct, this part. And if you magnify this, you can see how then the lymph follows this pathway from this duct, the thoracic duct, and drains, in this case, into the left subclavian vein, which it is draining eventually the fluid into the left brachiocephalic vein that together with the right will form the superior vena cava that drains into the right atrium. Any questions?
Professor, does that mean it's just a lot more vessels on that side? Doesn't necessarily mean they're larger in size? They're about the same size on both?
At least when it comes to the limbs, it doesn't change, and even for the thorax. But of course, the thoracic duct, because it receives more, that one will be much larger than the right lymphatic duct. And it depends if your right arm is bigger than the left.
Kind of like the heart, and then it's harder on the other side.
Okay, so we don't have a pump to drive the lymph to circulate, right? So still gravity will try to sink the lymph down into our lower limbs, our lower parts of our body. But then, just as the veins in our lower limbs have valves, we have valves also in the lymphatic vessels. So these are the lymphatic valves, and they prevent a backflow. And then since these lymphatic vessels are located between the muscles, contraction of these muscles help to leach the fluid from lower parts of our body to upper parts of our body, and that it helps a little bit. Now, we also have these smooth muscle walls in the lymphatic vessels that helps as well to with the contraction to drive this fluid into upper parts of our body and then back into the circulatory system. And thankfully, like I said, since these have a close end in the last part of the lymphatic vessels, any fluid is forcibly, by even volume, going up against gravity. Now, what happens then when we have vessel problems in the lymphatics, or we have things that can prevent this lymphatic fluid to go into the right places? So we will have swelling or edema, and that can be mild to moderate and sometimes severe, depending. If it's severe, you call it lymphedema, and that typically can lead to disfiguration of the area of the body that it is affected. And that can happen, again, when you are removing these lymph nodes. And then when you're removing lymph nodes, there's no way that sometimes you carry away part of these lymphatic vessel portions, and that block this circulation. So then the body of the part of the body that is affected will become enlarged. So here we have a patient with lymphedema in the right arm after breast cancer surgery, removal of the lymph nodes. Okay, so for the lacteals, they are located specifically underneath the microvilli in the intestinal cells. And these will absorb these, let me bring this down. They will absorb this lymph with these lipids, and then it will go into this part of the circulatory system that provides blood supply, nutrient-rich blood supply into the liver, so that you can process these lipids. So in the rest of the body, these lymphatic vessels can be also called lymphatic capillaries, but specialized in the small intestine will be called the lacteals. So here is how these lymphatic vessels look like. So this is capillary network, and then here are the cells that surround these capillary networks. So this is an arteriole, this is a venule. Remember, blood flow runs from the arterioles into these capillary beds, this capillary network, and then they drain into the venules. So here, these capillaries has the arterial end. This is the venous end, which has CO2-rich blood. This is oxygen-rich blood. And then in here, because you have more hydrostatic pressure, you excrete or filtrate fluid from the capillaries. And in this venous end, because you have more oncotic pressure, you absorb. But you don't absorb everything. The body is very generous. It gives more than usual. And part of this excess of fluid remains in here in the interstitial space. So this is the space in between the cells. And then who is going to pick up the 10% of fluid that remains here? Well, it's going to be your lymphatic capillaries or plainly lymphatic vessels. Again, they have blind ends, not like these ones that they are continuous. So then the fluid will be entering, the interstitial fluid, and once it enters into here, now you will call it lymphatic fluid. So if you magnify one of these, you will be able to see the walls. So the walls are made of simple squamous epithelium. So these are endothelial cells of the capillary, and they have kind of a loose connection in between. Because they have a loose connection in between, they allow the entry of this fluid really easily, and then you will have valves here that helps for this fluid to go from the blindfold end into, which is the distal region, into proximal regions of these lymphatic vessels. And since you have this open space, some cells can come in, including macrophages. What if it's a cancer cell? Well, cancer cells can enter into here and can disseminate through these capillaries. Cancer cells can disseminate through capillaries and also through blood vessels of the circulatory system. When it comes to blood vessels of the circulatory system, some cancer cells can release molecules that are enzymes that can open up a gap in these blood vessels, and then they can gain entry into these blood vessels. But when it comes to the capillaries, it's a free ride. Even macrophages, normal cells can go through here. So then for details about tissue, so we have reticular tissue. Reticular tissue is the predominant tissue in the lymphatic system. So in this case, we have networks of collagen fibers that runs randomly, and also elastic fibers, and they form a net. And with this net, what you will do is trap lymphocytes, both B and T. And then these B and T lymphocytes will be interacting with antigens that are found in the lymph. And these antigens can be your own, and they can be considered normal by these lymphocytes, or they can be your own and have a little change in the three-dimensional structure, and then your antigens will be recognized as foreign. And then your lymphocyte will start producing antibodies against these antigens. And then wherever these antibodies find these antigens, they will attack these antigens and the cells that have them. And that will be an autoimmune disease. And of course, if it's a foreign antigen, whether from a bacteria or from something that it was in the environment, like pollen, something like that, then your body would respond by creating an allergic response. But then the purpose of having these reticular fibers is to hold these cells, B and T, but also we can hold other cells like macrophages or dendritic cells. And they present antigens. We will see later how this happens. So reticular tissue then is abundant in lymphoid tissue, including lymph nodes. So here is how it looks. So if you magnify one of these lymph nodes, you see histologically, so these will be the collagen fibers and then elastic fibers that are called reticular fibers in general, and they run randomly. So they form a net and they trap these lymphocytes. And then dendritic cells and macrophages. And as the lymph is passing through, they get exposed to these cells, and these cells either respond or not. Hopefully, when these cells, like these lymphocytes, if they respond to your own antigens trying to attack, but your own antigens are normal, in that case, you're supposed to clonally delete or kill these lymphocytes because they are attacking your own body. But sometimes that fails, and that's how autoimmune diseases happens. I mean, it's kind of like when you have a dog, right? And you had it for years. And maybe I explained to you this before. But you had this dog for years. The dog becomes older, and that doesn't necessarily make him be able to recognize you and then not attack you. But let's say that you came from work one night, and then the dog, I mean, it's not seeing better anymore, but it doesn't smell you the way you smell and recognize you, and starts not only barking at you, but bites you. And then you talk to the dog and say, what's the matter with you? Right? You get mad because he bites you hard, thinking that it was someone that it wasn't supposed to be at your home. And then you pass it once. But then it keeps doing that frequently, and even to little children. What would you do? You would get rid of the dog. So similarly, we have the lymph flowing, and then it's some antigens, some cells will get trapped in here, and then these lymphocytes will recognize, well, is it my cells, is it my antigens or not? And then if it's your own antigens, they don't have anything wrong, but these cells start becoming a clone, start expanding and attacking these antigens, then they will be destroyed. So that's to prevent an autoimmune disease. So that's reticular fibers in lymphoid tissue. Now, when it comes to mucosa-associated lymphatic tissue, or MALT, you have loosely organized clusters of lymphocytes. And in this case, a difference between a tissue and an organ is that the organ, it actually has a capsule, so it has a defined shape, but a lymphoid tissue doesn't have a capsule, so that tissue will be scattered. But it's not going to be everywhere in the body. It's going to be in strategic places. Like in the case of malt, we have it associated to mucosas because that's where it's an area that is exposed to the environment where you can have contact with microorganisms and easily become infected. Like where do we have malt? In the gastrointestinal system, respiratory system, and the genitourinary system. And in some cases, we have specific names for this lymphoid tissue, but in some others we don't. Like we can have then clusters of lymphoid follicles or lymphoid nodules that has mainly B lymphocytes, but also you can have T lymphocytes. And in the center of this nodule, you have these germinal centers that undergo mitosis when someone has an infection and they enlarge, creating clones of lymphocytes, hundreds and hundreds of them, so that you can have more production of antibodies. Plasma cells, B lymphocytes, produce antibodies, and they can block the antigens from binding into your body. Now, we have a cluster of lymphocytes in our intestinal cells in the ileum that are called the Peyer's patches. Due to the name of the person who describes it, so these are found in the ileum, these clusters. The ileum is the last part of the small intestine. It's close to the large intestine. And in the large intestine, we have a lot of bacteria. So what we are preventing in here is that maybe some of the bacteria from the large intestine will go into the small intestine, and that's why we have this lymphatic tissue, these Peyer's patches, to fight any bacteria, any microorganism that can be found in there. The tonsils are other type of mucosa-associated lymphatic tissue. And then I told you about these adenoids that are found in the posterior nasal cavity. These are known also as pharyngeal tonsils because they are located in the nasal pharynx. Some people may have these adenoids enlarged for no reason at all, and these prevent the person from breathing really well, so they have a nasal voice. And when they're sleeping, they have sleep apnea. They have to breathe through their mouth. And if you see them, they have a lot of dark circles because they don't sleep really well. They have poor sleep. It's easily taken away. They scrape it off with some scrapers, surgical scrapers. And then the person, life changes a lot because they can breathe better, they can sleep better. So they are located then in the posterior nasal cavity, in the nasal pharynx, the pharyngeal tonsils. And then on the sides of the opening, posterior opening of the oral cavity, we have the palatine tonsils. Lingual tonsils are found at the base of the tongue. And then in the surface of the tonsils, we have tonsillar crypts, which is basically an indentation that helps to trap microorganisms. And last semester, I had a student who asked me, he asked me about these crypts, like if they can trap food. And yes, they can trap food. This food can be calcified and can be also, if something we have in the oral cavity is a lot of microbes. So this food not only get trapped, but also the microbes within this area, and then these would form like little stones, and then the person would have bad breath. And if you see the tonsils, you can see like little, like little dots, white dots. Sometimes it can be a little bit darker, but that pinpoints that there is entrapment of food. And it will be like one or two, not generalized. Because if you see bilaterally a lot of white dots in there, it's more than likely strep throat infection. And then the tonsil will be all reddish. I mean, by itself, it enlarges, even if you have a unilateral stone trapping these crypts. Okay? So inflammation of the tonsils is known as tonsillitis. So here's the location of each of these tonsils. So here are the pharyngeal tonsils in the nasopharynx. This protects against infections coming from the nose. This one, the palatine tonsils, infections coming from the oral cavity. Same for the lingual tonsils. So lingual tonsils are found at the base of the tongue, which is this. This is the opening of the oral cavity, posterior opening. So these are the palatine tonsils, and this is the pharyngeal tonsils. We have other ones that are not labeled in here at the opening of the pharyngotympanic tube that basically communicates the middle ear to the pharynx. And all of these tonsils together, they form a kind of a circle or a ring that is called Waldeyer's ring. Now, if you magnify one of these tonsils, you will be able to see these lymphatic nodules or follicles. So this is one lymphoid follicle, another one, and then in the center, you have the germinal centers. And this is a tonsillar crypt. So this is like longitudinal cut or transverse cut as well. So this is the epithelium of the tonsil. And then underneath you have your lymphatic follicles or nodules, your germinal centers, and they have these little crypts that allows for something that comes into the oral cavity or into the nasal cavity posteriorly to enter into here, like mucus, get trapped, and then if you have any microorganisms, they become trapped in here, and then the lymphocytes detect it, and then they secrete antibodies. And then again, these spaces can trap also food particles, and they can become infected. So this is just what I told you about where we have the Peyer's patches. So this is the ileum. And then attach into the cecum, which is the first part of the large intestine on one side. We have the appendix, vermiform appendix. Vermiform appendix, it's very tiny when it's not infected, and it has lymphoid tissue also internally. Since it has a tiny opening, unfortunately, it's very easy to get obstructed. Whether it's tonsils or this appendix, they are constantly secreting fluid. In the case of the tonsils, they secrete fluid into the crypts. But when it comes to the vermiform appendix, into the opening that drains into the cecal. Sometimes pieces of food or fecalites, which are like little pieces of fecal matter, can obstruct this appendix. The fluid doesn't drain, and that enlarges, and that causes inflammation of the appendix. And then most of us, we know that when the appendix is inflamed, it requires, of course, surgery. Why? Because it can rupture, and then if it ruptures, it's going to release part of the contents, which is going to be bacteria, maybe fecal matter, and that can lead to inflammation of the peritoneal, and that leads to death, peritonitis. If someone, of course, has the appendix, pain in this area, the right lower quadrant, is indicative, or maybe here in the hypogastric region is indicative of and it's sharp pain of the of appendicitis. It can be something else as well, but it's one of the things that you need to rule out. And then, of course, you have to ask the person, do you still have your appendix? Because if they don't have it and they have the pain there, then there's something different. So here is more malt in the large intestines, aggregated lymphoid tissue. Here's the appendix. So this is a magnification of small intestine showing you these lymph nodules and then the germinal centers. So basically this is a bunch of lymphocytes, B lymphocytes. Lymph nodes, so they're small when they are not enlarged due to different reasons. They have like a pinto bean shape with a convexity and a concavity. In this convexity, they have several lymphatic vessels going and providing lymph so that the lymph can be filtered. And in the concavity, you have a single vessel exiting. The vessels that arrive are called afferent vessels, and the vessel that exits is called efferent. So you have several afferent vessels coming in and only one afferent vessel coming out. I don't know, I think I asked you this before. So what is the purpose of, let's say this is a lymph node, and I'm going to draw it. And you will see in one of the slides better details than what I'm drawing here. But these are afferent. So what is the purpose of having several afferent in this convex side and only a single efferent in this? And we're talking about the number, not where they are located, but why we have many that come in and only one that comes out?
Because it's picking them up, right? So they're being filtered, being cleaned out. So not all of them will come out?
Yes, so basically you have here your lymph nodes. Right. So you have all the lymph coming in. and then it will come out. So what you're trying to do is give the chance for filtration. In a concert, at the beginning of the concert, what they do, they open all the doors so people can come in really quick. When the concert is gone, typically they close several doors. They're controlling the flow. So you give time for this lymph to be filtered. What if there was a room with several entrances and then something very valuable got lost? And someone noticed. Well, they closed the side doors, they only have one door open, and they expect everyone to see if they have the item that they steal. So you're trying to catch cancer cells, bacteria, etc. It's not a waste of efforts. It's for a reason. And now, so where do we have these nodes? In strategic places. In the axillary area, you call them axillary lymph nodes. Cervical lymph node, you have superficial and deep for infections that are superficial or some that can be complicated deep. And then in the inguinal area, in the groin. In the abdominal cavity, mesenteric lymph nodes. So we will expect then that based on these strategic areas where they are located, it is where you will have the response to infections or cancer, enlargement of these lymph nodes. So, of course, if someone has an STD, sexually transmitted disease, you expect that the first lymph nodes that are going to be infected or enlarged is going to be in the groin area, right? Someone has a throat infection, you expect the cervical lymph nodes to be enlarged. There could be exceptions to the rule, but swollen lymph nodes that are painful typically means infection. And swollen lymph nodes that are non-painful means something malignant. Maybe it's a cancer. But there can be exceptions, okay? Now, internally, the lymph nodes are subdivided into segments by extensions of the capsule that we know as trabecula. So the lymph nodes, because they have a capsule, they are an organ. And then in this tissue, we have also medullary cords. They are found in the central part of the lymph node that we call medulla. And in here, in these medullary cords, we have mature B cells and macrophages. So there is a difference between the collection or the clusters of cells that we have in the lymph nodes. If it's in the cortex, we have in the area between the cortex and the medulla, we have mostly T cells. While in the medulla, where we have the medullary cords, we have mature B cells and the macrophages. And then, again, as the lymph flows from the afferent into the efferent, you have more exposure of this lymph into different areas of this lymphatic tissue inside the lymph nodes. So we have a space underneath this afferent lymphatic vessel that is called subcapsular sinus. Why they are called subcapsular sinus? Because it's underneath the capsule. Sub means below the capsule. And it's called a sinus because that's where you have a little space that helps to retain a little bit of the lymphatic fluid, and that's where you expose it to these T lymphocytes. And then from there, the lymph flows into the cortical sinuses to the side where you have more of these T lymphocytes. And that's where you trap 90% of the pathogens in this area. And then after that, the lymph will move into the medullary sinuses, so it goes from this subcapsular sinus into the cortical sinuses and then into the medullary sinuses, and then after exits into the efferent lymphatic vessels. And that indentation where you have this exiting or efferent lymphatic vessel is the hilum. You will hear this word over and over again, hilum. Hilum is indentation. You will hear it in the lungs, you will hear it in the kidneys. So then, from afferent lymphatic vessels into subcapsular sinus, into cortical sinuses, and into medullary sinuses, and then into efferent lymphatic vessels. So that's the flow. Let me write it down here. So that's how it goes. Afferent to capsular, sinus to cortical sinus, medullary, and then efferent. And this is like the most critical part. The cortical sinuses and subcapsular traps 90% of the pathogens. So here it's enlarged lymph node. So you can see the different structures. So this is the capsule. This is the trabeculae that makes segments out of this. And then you have this afferent and this efferent. And then you have an arterial vein and a vein entering through this hilum to provide blood supply to these different nodules. So here we have the lymphoid follicles. Here we have the germinal centers. And then this space is called a subcapsular sinus. So as the lymph coming in, goes first into here, and then goes into this cortical sinus then. After, that's where you trap 90% of the pathogens, and then goes into this medullary sinus, and then goes into this efferent. So we will leave it up to there. Do you